650 microsecond technology is a new advancement in laser medicine which was invented and developed by Aerolase Corporation. The unique clinical benefits of this technology, in comparison with prior technologies, are described in the following lecture by Dr. David Goldberg, a dermatologist and director of Skin Laser and Surgery Specialists in New York, New Jersey. His lecture initially focuses on vascular applications, with further discussion of other skin applications that are available with this new technology.
So I'm going to talk about vascular laser treatments with Aerolase's new 650 microsecond technology. And in the world of all these different devices out there and the confusion between all of them, this really is pretty novel and unique, and you'll see that as I go through this talk. And so, when we treat vascular lesions, we have lots of choices, and there have been a bunch of different devices on the market. And certainly in the laser arena for treating vascular lesions, pulse dye lasers starting first at 585 nanometers, going up to 595 are still around. They certainly work, but there are all these issues with the dyes that we constantly have to replace. KTP lasers, 532 nanometers certainly work, don't penetrate very deeply. And then there have been a whole slew of 1064 nanometer systems, all within the millisecond domain, which I'm going to talk about. Can you hear me okay? Oh, it's you? Okay. It's like when someone starts rubbing something, you wonder, like, is there something on my mouth? Okay, the 1064 nanometer range, there are a lot of millisecond systems out there, have been used, and I'll talk about them some, and then we'll differentiate between them and this microsecond domain system. And so whatever laser you're looking at, if you want to treat vascular lesions, the things we're trying to focus in on are an affinity for hemoglobin. You need hemoglobin absorption by whatever wavelength you choose. Ideally, you want as deep penetration as you can get, yet still be absorbed by vasculature. And ideally, you want high power because you have to break down this vessel wall one way or another. And so here we have it. We've got KTP at 532 nanometers. There's a little bit of a hemoglobin absorption peak there. The 585, 595 peak, and then as you know, 1064 nanometers is another third peak for hemoglobin, all of which are absorbed by hemoglobin. The longer the wavelength, though, comparing 1064 Nd:YAG to shorter wavelengths, 532 KTP, 595 pulse dye laser, the longer the wavelength, the deeper the penetration. So the deeper the vessels you're going to get. And sometimes when you're treating things like rosacea, with flushing, they're deeper vessels, and some of the shorter wavelength systems will never get to them. And so if you look at the typical 1064 nanometer system, it's high powered, and some devices can achieve very high fluences, but they're generally in this millisecond domain, and that's led to some problems. What's good about the wavelength, though, 1064 nanometers, no matter what system you're talking about, is that affinity for hemoglobin, the deep penetration into the vasculature, and the high peak power you can get to break down vessel walls. So what are the historical limitations to the other systems that are out there? Pulse dye laser, look, it's always going to be the gold standard. It's been around since the 1980s. It's effective, but it doesn't penetrate all that deeply. It certainly is associated with some discomfort. And if you use higher fluences and shorter pulse durations, you're certainly going to get swelling and purpura. KTP lasers, 532, pretty short wavelengths, by and large are very effective for small vessels, but that's pretty much all they can be used for. As you get to the 1064 nanometer wavelength, as I said, you've got some water absorption, which has some benefits, and you've got some melanin, which it's absorbed by quite poorly, but the longer pulse duration systems are also associated with discomfort and scarring. So this system is not a millisecond system. It's a microsecond system, 650 microseconds, or 0.65 milliseconds. You can get the very high fluences that we talked about that you need for vessel destruction, anywhere up to 255 joules per centimeter squared, and you can deliver it with a shorter pulse duration, which is safer, but also leads to very little discomfort. Because you have the high fluences and the shorter pulse duration, you get rapid heating of the target vessels that you want to destroy, but you're also avoiding collateral thermal damage, which is the problem with scarring that's seen with millisecond domain Nd:YAG lasers. So you're leveraging here power, depth of penetration, and hemoglobin affinity of the wavelength, 1064 nanometers, but at the same time, you're avoiding the collateral tissue damage seen with the more typical 3 to 30 or more millisecond domain Nd:YAG lasers. So that's me, all that hair on my head. This is a study we did a couple years ago, published last year in Derm Surgery. We looked at 20 patients between 35 and 70 years of age, Fitzpatrick skin types 1 through 3. They got 2 treatments a month apart for a couple of months, and we used this 650 microsecond Nd:YAG laser from Aerolase. We used 2 millimeter spot size, small spot sizes, pretty high fluences as I talked about, 191 joules per centimeter squared, going over vessels and areas once. We evaluated results in terms of treating erythema and telangiectasias based on clinical assessment of digital photographs and both patient and investigator assessment of the reduction in the size and appearance of telangiectasias based on a 5-point scale. The results that we saw, patients experienced significant and sometimes even dramatic improvement in the appearance of facial vessels because of that short pulse duration, 650 microseconds, even with these very high fluences of 190 joules per centimeter squared, very little discomfort, and I really encourage people to zap themselves and see you barely feel it. And because of the shorter pulse durations, we saw no complications or adverse effects. So there's the laser being fired onto the skin. As I said, we've got high power and depth of penetration, very gentle treatment, versatile, covering a broad range of vascular conditions, smallest vessels, broad erythema, some bluer vessels as well because of the 1064 nanometer wavelength. There is no skin cooling that's required with this, something that's always required with millisecond domain Nd:YAG lasers. We use no topical anesthetic, and you don't even have to contact the skin with a handpiece. And so here's one of the patients we treated, and you know, it's not perfect by any means, but the results are pretty dramatic after 2 treatments. You can see the telangiectasias are improved, the broad erythema is improved, and the overall skin texture is improved after 2 treatments with the 650 microsecond technology. This is not our patient, but you can see typical facial small telangiectasias, something that we might typically treat with a pulse dye laser and get purpura, or with a KTB laser, but not get the depth of penetration we want. You can see some of the vessels on the lower left face have more of a bluish tinge, where a 1064 nanometer system will come in, and then this 1064 nanometer laser can be used to treat both the red and the blue vessels. Here you see broad erythema, some poikiloderma, improved again after 2 treatments. This is Michael Gold from Nashville. And again, this broad spectrum of vascular anomalies on the face, rosacea, erythema, even some papular rosacea here, telangiectasias, all improved, not a lot of treatments. Typically, if I use a KTP laser to treat telangiectasias, I use 3 to 4 treatments. Here, because of the deeper penetration, the results are often seen after 2 treatments. Again, that broad erythema, which I find is very difficult to treat. We've treated with IPLs. Generally, we have to have 5 treatments, and here you can see the improvement after only 1 treatment. Same thing again, significant broad erythema, almost looks like a butterfly rash, rosacea, 2 treatments, and the marked improvement there as well. You know, we talk about using fillers and neuromodulators and the ecchymosis we often see, and certainly pulse dye laser has been used to break up that ecchymosis. This system works equally as well. You can use 1 treatment here, and you're breaking up the black and blue and the ecchymosis very nicely after only a single treatment. Here you get a sense of what 1064 nanometers can do. You know, it's absorbed by hemoglobin, it's absorbed by vessels, but because of the deep penetration and the collagen remodeling that also occurs with this wavelength, you can see here improvement in acne, in the erythema, and even the acne scarring is somewhat improved because of that dermal remodeling. So in the end, yes, it's a vascular lesion laser. It's 1064 nanometers. Its safety and its efficacy is related to that shorter pulse duration, which no other system that I'm aware of has. But it really is not only a vascular laser. It can be used for many of the other applications which long pulse Nd:YAG lasers or IPLs are used for, but really with a new level of safety and equally as important gentleness. And with that, I'll take whatever questions anybody has. They do have a couple different spot sizes. So the spot size used for this gives you 191 joules per centimeter squared, but there's a larger spot size, 6 millimeters, which gives you lower fluencies, which you can also use for broad erythema. And this spot size, the small one, with 190 joules per centimeter squared, you hardly feel it. The larger spot size, basically feel nothing. Like a bluer vessel, but all 1064 nanometer systems will work for blue vessels. The difference here is, and I know you have, if you use 1064 nanometer systems, typical ones that we all have, with longer pulse durations, you occasionally get that ice pick scarring because there's so much heat generating. This works so you don't see that. So. Small vessels on the legs. So I mean, the way we approach vessels on the legs, if they're larger blue vessels, sclerotherapy is still my treatment of choice. But if they're smaller vessels, and particularly if they're red, we'll always use 1064 nanometer lasers. And again, the comparison between this and a typical millisecond system, almost no discomfort at all. You're not going to get scarring, and they both work. And then the size of it. I mean, if you look at the size of these systems, this is something that not only we can just take from room to room. I have a bunch of offices. This goes in the car. Think about the other 1064 systems. Pretty big, okay? Certainly can move them from room to room. Can't take them from office to office. This is a little suitcase that's about the size of my briefcase. Yes, no, yes? Nothing?
Any other application you use it for?
Well, so think about the other things that you can use a 1064 nanometer laser for. We use it for dark skin hair removal, and there's no reason you can't use this as well. Same idea. It's going to be very safe. It's the right wavelength. The shorter pulse duration is going to make it safe. Those people who end up with paradoxical increase in hair growth following some of the other systems, typically you have to treat those people with shorter pulse durations. And this is as short as you're going to get with the 1064 system. So a lot of applicability. We've used it for acne. I showed that. No system does everything, but it's got a broad range of uses. His question is, how many treatments do we typically need for facial telangiectasies? What I showed you was 2 treatments. There are occasional people who have 1, and yes, once in a blue moon it's 3, but I tell people 2. And I think you can see what's going on here. And that result, they'll see that result within a month of the second treatment, but it continues to improve for 3-4 months afterwards. Okay.
In terms of discomfort, you already mentioned.
Yeah, I think, it's unfortunately you can't do this in the exhibit hall, but whoever wants to look at this laser, I encourage you to look at it. And I am the ultimate wuss. I really am. I can't stand any pain. I have zapped myself with this accidentally and purposely. You barely feel it. But that's all because of the characteristics of the pulse duration. So it's really not rocket science. It's really the parameters.
you.